Speaking to you, we have 2.6 million poor and vulnerable households in the National Social Register. And once you are in the register, then you will be enrolled into the National Social Beneficiary Register. That also goes through a process. So this is a program that has gone through this process, and we have beneficiaries on board. But with the coming of the COVID-19 pandemic, we were directed by Mr. President to give 2 months advance payment to these poor and vulnerable households. In the program, we give them 5,000 naira per month, and we pay them 2 months, 10,000. So with this directive, we now pay 20,000 naira per month to these beneficiaries. We've just started the February, March, April disbursement. And by next month, we'll start the May, June disbursement. That's how it is being carried out. In the last broadcast of Mr. President, he also directed that we expand the scope of the beneficiaries. And that is where we are saying we are going to look at this issue very critically. And our focus will be really on the urban poor. People that live on daily earning for their livelihood, and people living with disabilities, as well as other vulnerable groups. And that's why we will come up with these options of using the BVN of the bank accounts of these groups that do not have more than 5,000 naira in their accounts. And then the mobile phones, those that recharge their phones from 100 naira and below monthly, and then also the ones that we have in the register already waiting for enrollment into the beneficiary
That is the crux of the matter, yes. Because these urban poor are spread all over, and persons with disabilities are spread all over. What manner of collaboration does your ministry have with the banks that will warrant if the effectiveness of this distribution, if at all it will be?
Well, we are collaborating with the Ministry of Finance through the CBN and then the NIPS to get the data of this group of individuals that have this, that fall within this criteria. And we're also working with the Ministry of Communications through the NCC to also get the data of all the telecom companies that have people that recharge, their phones with 100 naira and below. We have held a meeting with them earlier this week, and I'm expecting to report back to the presidency on the outcomes of our meeting with them and what we've been able to get from these organizations.
Okay, and since the president has already stated that 1 million people will be added to the 2.6 million beneficiaries, now if you're going to digitalize this process of payments, is it going to start with this 1 million people, or are you going to expand the scope? Also, how many states so far have benefited from this CCT?
Well, for the purpose of this COVID-19, I think that's why Mr. President, in his wisdom, directed that we expand the beneficiaries. So that's why I mentioned we are focusing on the urban poor that might not necessarily be in the register. Okay. So what we have in the register is going to be there.
The 2.6 million.
Yeah, the 2.6 million. And they are not all enrolled as beneficiaries. They are in the register. It's from that register that we move them to the beneficiary register. Okay. What we have currently is 1 million people that we are paying. Okay. But we have another balance in the National Social Register. But for the purpose of this situation that we are in, that's why we are using the BVM, we are using the mobile phones, as well as using some of the people that fall within this criteria that we already have in the social register, that we can move them today. And before now, we have also had discussions with the social protection donor group of the UN, and they have agreed for us to also expand the rapid registration for the COVID-19 response by 1 million beneficiaries. So that while that is going on, we also have this directive that we're also
maybe you need to explain this. Social protection group, what are they
Social protection donor group of the UN.
Group. Okay, of the United Nations.
Of the United Nations that has been shared by the World Bank. It is a World Bank funded program anyway. It is conditional cash transfer. So we have had discussions with them, and we have gotten approval to expand by another 1 million. In this case, we are going to get the ones that we already have in the register that have not benefited, for them to be moved
out of the 2.6.
Out of the 2.6 to be moved into the beneficiary register. Now we're going to have 2 million people.
But does it cut across all states? Because there are agitations.
Really, it cuts across all states. Well, the issue is, because of the processes involved, if we're going to the state, we notify the state governments, and there are certain commitments that state governments are also supposed to make, especially in the area of training the people that we're going to take to the field to get this data for us. And they are supposed to be in teams of 6 in number. But if a government decides to do it as fast as possible, they can increase the team by funding that team in the training as well as in the logistics involved. So that is why you see in the register, some states are higher than others. And we're supposed to start with 30% of all the local governments in the state. It's when we are able to saturate that 30% that we go back for another 70%. But some states were not really committed to the program ab initio, and so that's why you see the disparities in the figures across the states. But for instance, like Ogun was not in the program. It was when I visited Ogun last week that we had very extensive discussions with the governor, and he realized the importance of this, now seeing that other states are benefiting. And then he, committed himself that he's going to, provide all the logistics involved to see that his people are also enrolled into the program.
This area you need to really explain very well, because it appears this is where a lot of Nigerians appear to have some misgivings about the transparency or the accountability of the payments so far, or the distribution, if we can call it so. So you may have to go back a little and tell us, in the last 1 week or so, how much has been distributed and to what state, and what were the modalities, so that people will now know that there was really a transparent method of the activity.
Well, as at last week, or as at early this week, 25 states of the Federation have been paid. And this is into hundreds of millions of naira. I cannot really say the exact amount.
So it's going to be, let's roughly say 20,000 times.
20,000 times, depending on the number of beneficiaries in that state.
Okay.
But it's supposed to be 20,000 times 1 million people. If we are going to
look at the entire,
we're going to capture the entire people that are on the program, and don't forget Ogun might join in Lagos in the next payment cycle. So the figures will increase definitely. And on the purpose of transparency and accountability, I think we've been transparent enough by going out there to flag off this program, to make sure that the beneficiaries are getting these monies as they are supposed to get them. And then it is a process that really involves, is a very tedious process, and we're disbursing cash for now, but the ministry is working on digitalizing this process end to end. But don't also forget the fact that we have some beneficiaries that are in the remotest parts of this country that are not on any banking system, and they don't have any mobile telecommunication.
So how do you reach them?
So these people, you have to reach them, giving them the cash using the payment service providers as is obtainable now. But we hope that at least we'll be able to minimize to a very large extent, the usage of cash disbursement by the time we're able to digitalize this process end to end.
And talking about these payment service providers, you terminated a contract of one just some days back, and you're also looking at the World Bank procurement guidelines. Now, for these World Bank procurement guidelines, would it apply to all states, talking about these payment service providers?
Well, yes, it's normally the World Bank that does the processes of this procurement, because it's a World Bank funded project. But for the purpose of this particular vendor that we terminated the contract is because they have defaulted. They should have been in the program since last year, but they're not able to deliver this service, and we felt it's just very unfair to the beneficiaries to be really deprived of their entitlement or of their stipends just because of the fault of the vendor. So we felt we have done everything possible to see that they live up to the agreements of the contract, but they have defaulted, and so we were left with no option but to terminate that contract. Now we're going back to the World Bank to follow the procurement guidelines, but it's not going to be as tedious because we're not starting all over. Already we have some vendors in the program who have the capacity to deliver. So we're going to select one of such a vendor to now go ahead and provide this payment to these affected states. And these states are four. We have Bayelsa, Abia, Akwa Ibom, and Zamfara State. And we hope that between now and the 28th of this month, we'll be able to take these payments to these beneficiaries.
It's interesting that the Zamfara is your state and they are not being paid.
Well, yes, this is where we find ourselves, but it's not about being my state, but it's about seeing to it that every state in the country benefits from this program.
Now, why do you think, or rather, recently the leadership of the National Assembly had some misgivings about, and then they made demands about the need for reforms. That's the word they use. Reforms of the modalities or criteria for the distribution of the palliatives for COVID-19. What are their observations? What are you hearing from them? Because they went ahead to even hold a closed-door meeting with Mr. President. We'll come to that. But what did they tell you in the closed session they held with you at the National Assembly?
Well, Mohammed, you said it's a closed session. So it's a closed session is not something that I will discuss, but the bottom line is that the national members are very concerned about the modalities used, because as representatives of the people, they feel they are stakeholders, and really they are stakeholders. They are the people that represent the people from the grassroots. So whatever is going to these people, they should be involved. They should be part of it. And they're not in any way saying that we should not use the criteria that will not jeopardize the integrity of the process. All they're saying is that they need to be carried along. Because they are the true representatives of the people, and most of these palliatives, is geared towards this particular group of people. And so we have had very extensive discussions with them, and going forward we are going to look at all these issues and come up with the best way to address these issues.
So
what are your thoughts? Let's remain in this. What are your thoughts with regard to carrying them along? Because you just told us of the need to adopt the United Nations procurement guidelines, and here you have your national legislators wanting to be carried along. How are you going to carry them along and at the same time adhere to the strict rules of procurement guidelines?
That's why I said that carrying them along without jeopardizing the integrity of the process. There are people that represent these constituents. And I mentioned earlier that the process involves community engagement. So when we're going back to these communities, they are representing these people. So they will be part of those people that will be in the identification process, for instance. So it's not
that is selecting the beneficiaries.
Selecting the beneficiaries. Okay. It's not a one-man squad. It's not one person that will do it. It's a group of people that come together that are respected in that community to identify which households fall within the criteria set out. And every community has its own poverty definition level. What is poverty in this community might not really be the same in the other community. So I think we're all stakeholders in this, and the objective is to reach out to these particular groups. And I know that everyone will live up to his own responsibility.
I was listening to the radio this morning, and someone was saying they're also poor, that why are they not reaching out? So maybe for clarification, when you say criteria, what are the criteria for selecting these people?
That's why I told you it depends on what the community defines as poor.
Okay.
Maybe this community will decide this household really cannot feed 3 times a week, a day, 3 meals a day. That is maybe poor in that community. Or they will say, no, in this household, they cannot afford to take their children to school. That is another component of poor and vulnerable. And so on and so forth. So it is the community that really will determine what is poor and vulnerable in that community, and we work with that.
Okay, so let's look at other palliative measures, food items also, and not just money. NEMA, we made to understand, is supposed to start a distribution of 45,000 tons of metric tons of food items to the affected states, Lagos, FCT, and Ogun State, out of the 70,000 metric tons. Have that distribution started?
Oh yes, it has started. Mr. President directed that we'll be giving 70,000 metric tons of grains from the Strategic Grains Reserve by the Ministry of Agri. We have received these grains from the Ministry of Agri. We are deploying these grains. As I'm talking to, the ones for Lagos have been deployed, and the ones for Ogun have also been deployed. FCT, we have gotten some. We have some waiting that are coming in from Malaysia. So we have started the process, and we have a structure, the emergency response plan structure for distribution of these palliatives, food relief. It's a structure that has the national, states, and the local government. Every stakeholder is involved in this distribution. We have state SEMAs, we have local government committees, they come together, they identify which location to take these palliatives to. And it's by a way of physical identification and data capturing of the poor and vulnerable using the structure of the disaster response plan. This has been done. And I must say that the strategy used is we take 25% of the population. That is the target by the
population of a state.
25%. It's a food package of the grains, 25 kg of each to each household.
Okay, and also the president...
I think there's a need for her to tell us what other things are in that package. Just grains or...
Well, what we have in the strategic grains reserve is grains. Sorghum, millet, maize, and gari.
Rice.
Those is what we have. The rice now is coming from Nigerian Customs Service.
That's what I wanted to ask.
That has also been directed, and the CJ Customs has directed that we'll be giving these items. We are still collecting the items, and I've already taken the ones for Lagos and Ogun. The one for FCT is to arrive maybe today or tomorrow, because we are bringing them from Lagos, while other states will also follow suit as we receive.
No palm oil or sugar?
No palm oil, no sugar for now, but there's vegetable oil in the package.
Okay, and from the question I wanted to ask, following what you just said, it's supposed to be, the president gave a directive for 150 seized trucks of rice, and so far from what report says, you've collected just 40 trucks.
Yeah.
Have they given you reason why they're not releasing the rest?
Well, they are still tallying the figures. They are still collating from different commands or from different locations. The ones we have been given now really is one in Lagos and One. We're supposed to get 19 trucks from One, but we're able to get just 5 as at this morning. And then the ones in Lagos is 40 trucks. I've already deployed 20 now. We have 20 remaining. The ones in One, we took 3 to Imo and 2 to Ebori. They are waiting for 1 to be completed.
Okay. Now, there's also the issue of the trader money and for artisans, for petty traders, that you've already started distributing in Lagos and Ogun State, if I'm correct. Now, would that also extend beyond the lockdown states, that is talking about FCT, Lagos and Ogun State? Will it also extend to other states? Because other state governors are also imposing the lockdown restrictions on their states. So would it extend?
And they have made, if I just can add, they have made comments and demands as to, under the governors' forum, that is, that they are expecting the federal government to do something.
Yes, hopefully we'll be able to do that, but we are still also waiting for directives in that regards.
Okay, so for now it's just Ogun State and Lagos.
For now, for the trader money and market money, Ogun State, FCT and Lagos, but we're extending to other states because it's already an existing program. Other states are definitely going to benefit from it, but we're just starting with these 3 states. We still have something in the kitty for the other states. So for this particular program is go around the states where we have these beneficiaries. But for the food palliative, as I mentioned, on this strategic grains reserves is for these three states, while the rice from customs is going to all the states.
Honourable Minister, your ministry has the mandate of coordinating all humanitarian activities of the federal government and, of course, Nigeria. We are told that the private sector coalition against COVID-19, the donations have now hit more than 19 billion naira. What exactly are the figures? Is it 19 or more than that? And if it is 19, where are we going with such monies?
Well, I think what is happening in that private sector is that they are pulling these monies together, and then they're going to use these monies to supply or provide the needs of the country, be it medical or in palliatives. So it is a private sector arrangement. I think the chairman of the task force will be in a better position to really explain how that is happening. But
you're a member of the task force.
I'm a member of the task force. From what we've been briefed is that they're going to handle this intervention themselves by way of we send the needs of the country as it relates to this COVID-19, and then they'll provide for it.
Do you have an idea as to how much has been generated or collected so far?
I don't.
Now, let's look at another donation, the United Nations Basket Fund, that is appropriately called. It's supposed to be assistance from the coalition of the United Nations countries, and it's supposed to be for equipment and other palliatives. How far so far in that regard?
Well, I think the United Nations had come together also to donate, to have a fund for Nigeria. And just 2 days ago, the EU, visited Mr. President. I was in that meeting, and they have also pledged to donate 50 million euros to that basket. So this also is a basket that they're going to use the fund to provide for the country, for the country's needs, especially in medical equipments. 2 days ago, we received the first consignment from, I think, China, that is part of this donation of the UN basket.
Okay.
So that also is coming, so to speak, in kind, so to speak.
So not everything is going to come in physical cash?
No, not even anything. I don't think anybody is bringing for these two organizations, the UN and the private sector. They have not they're not bringing anything cash.
Okay, Honorable Minister, there is also one area of concern. The children are also on lockdown, and you mentioned the homegrown school feeding program that would extend to their homes. And a new measure you brought up was the voucher door-to-door. How are you going to achieve that?
Well, that is also another directive by Mr. President that we should continue the school feeding program, although schools are closed and children are back at home. So on this, we had discussions with the governors through the Nigerian Governors Forum, and we have come up with the modality, and this is the modality that was adopted to give them the dry food ration or take-home ration to these homes where these children come from. We have a structure already that we are working with. We have vendors that provide the food raw materials to the cooks that cook the food within the same locality or the same community. We have the school the teachers or the school headmaster who is also within that community. So we're using all these structures on ground to identify these households, and then we provide these vouchers. We also have other personnel on ground, especially the community service development personnel in all the communities. We're using them in the distribution of these vouchers. We are using the NIPOST also to get these vouchers printed, and also their personnel on ground to see that we distribute these vouchers, and then we have designated distribution centers within the communities that these members of the household will go and present and pick this food ration to their homes. And we believe that in every home we'll have at least 3 children in that home. So the package is going to, really take into consideration the number of the children in that house.
When is that beginning?
Hopefully by next week we should start that.
Is it going to be strictly children who attend, excuse me, public schools in their communities, or will it extend to other vulnerable homes?
Well, in every home where you have a child that goes to school, he will have his siblings or her siblings in that home, so they will also be taken care of. For the purpose of this homegrown school feeding, there are other palliatives that are going to the poor and vulnerable households.
Yes.
For example, the cash transfer, also the food distribution that we are doing. Households are going to be identified, and they also get that.
Okay, let's look at the IDPs in the Northeast. What are the plans put in place?
The IDPs have been very well taken care of. From the beginning of this lockdown, we have taken 2 months food ration to the IDP camps, the official IDP camps in the Northeast especially. And for the other IDP camps, we have also taken some this relief. The ones in FCT, we are in the process because we are waiting for the last deployment of the grains to start. But we've gone to the camps, we have sensitized them, we have taken sanitization, hygiene items to these camps, and we have their numbers. We are working with the FCT authority. We know the number of camps that we have within the FCT, and also other states where we have these camps. Most of these displaced populations, they live within the host communities. State that you have, like my state, for example, Zamfara State, we don't have an official camp in the state, but we have people that are displaced, but they live within the host communities. And all these interventions in these lockdown states where we have IDPs, we're taking these interventions. But for the other IDPs that are officially recognized in their camps, it's a routine thing. Every month they are provided this food ration to them. Each household within the camp is being given this food ration. But for the purpose of this COVID-19, Mr. President directed one, we give them 2 months, and that has been done.
Now let's look at the issue of the government enterprise power program and of course the NPower. Since you are here, I think it would be nice to use this opportunity to also speak to these programs that are under your ministry.
Well, the Government Empowerment and Enterprise Program, GIP, that is one that we just spoke about. The trader money, market money, and the farmer money is an existing program, and we have expanded. That was what I flagged off in Lagos and Ogun for the lockdown states and FCT. But it's an existing program, and in that program, Mr. President also directed that we give a 3 months moratorium to these beneficiaries. That has already been done. We have notified them, and then we have expanded. So that has been taken care of. For the Empower, the Empower program is a program for the graduate youths, as you are aware, that have been enrolled into the program since 2016, while others were enrolled in 2018. The first batch of the Empower beneficiaries were the ones that were enrolled in 2016, 200,000 of them, and 2018 we enrolled 300,000. We give them monthly stipends of 30,000 naira, and they are mainly teach. They teach public schools across the country. We are faced with some challenges of payment because paying 500,000 people from public funds has to go through processes, financial rules and regulations, and then procedures. And this is what we do every month. If at all there's any delay, it's not on purpose. It is just for us to make sure that no beneficiary is omitted, and at the same time, no ghost beneficiary also is paid. So this is a normal routine processes that we must go through for the purpose of transparency and accountability and even prudence. And we all know that Mr. President is very, very particular about these three aspects of managing public funds. So this is what we do. I know that it came to my table. The normal procedure is to ask the accounting officer to advise. It comes back. Before he will advise you, he will also push it out. So it's a process.
So was that what was responsible for the initial delay in payment?
It will continue to be like that. Let me say it here. It will continue to be like that.
There's going to be continuous delay?
It is going to be through these processes. So if somewhere along the line we get delays, it's not on purpose. It's just that it's going through processes and procedures of government. That is one. And it is also very important for us to understand that these beneficiaries on this program is not a permanent thing. We are also working day and night to see how we exit these beneficiaries to put them into some kind of permanent job, so to speak. So it's a process we're undergoing, we're going through day in, day out to see that everyone is better off for it at the end of the day.
Don't you think, for the sake of the NPower beneficiaries, the government should come up with a foolproof procedure that will be hitch-free and not cause any delay in the future? Because this is a program you have done in the last 2-3 years.
This is the hitch-free, Mohammed. It's a program that people have been on for years. But at the same time, we can't say that the same number of people that have enrolled into this program are still in this program. Some might have gotten their permanent jobs and have moved on. Something might have happened to some of them, maybe.
But are they still collecting the stipends?
These are the things where always, every month, you have to go through this process and procedure to make sure that we fish out those that are not on the program, so that we don't. That's why it's so that we don't pay ghost beneficiaries.
But you're also
and at the same time, so that we don't omit those others that are still on the program.
So what are you going to come up with? Because I know you're working towards overhauling the process. So what would you recommend?
Well, we're still in the process of overhauling one, to strengthen the base, to expand the base as well, to also make sure that these people that are on the program, they exit on something to fall back on. These are all the processes. We are also working on expanding and even doubling the beneficiaries. We're also working on making sure that other beneficiaries come on board, so that they are not, marginalized, or they are not, because there are people in the queue waiting.
Yes.
Yeah, I think there's a need for you to you have touched substantially on the issue of the reforms of the conditional cash transfer. Maybe let's look at holistically the need for reforms of the various programs, both the CCT, the NPower, the Government Enterprise Empowerment Program, and
this is all what we are working on. All the SIP's programs, we are looking at how we are going to reform them, or to improve on what we have, to build on the existing ones. This is what the ministry is working on. Don't forget that these programs came to the ministry late October, and we started being debriefed by November. We're in March, so it's a whole lot of process. It's a process that took 2 years to be on ground, or to be in place. You don't expect us that within 3 months or 4 months to finish the overhaul or the reorganizing of the process.
What's your timeline? What's your target?
Is intended to improve.
Yeah, what is your target?
Well, we hope that
what target are you giving yourself?
We hope that by July we'll be able to come up with our changes.
Without the lockdown, though.
Even with the lockdown.
Okay.
Well, the ministry, you are Minister of Humanitarian Affairs, Disaster Management and Social Development. Let's look at some aspect of disasters. Of recent, we have recorded issues of fire disasters, fire occurrences of some very strategic institutions. Does it worry you?
Of course it does. And one of the mandate of the ministry is to ensure strategic disaster mitigation, preparedness, and response. And this is what also we've been doing, and we're trying to improve on what we have on ground. And I must say that most of the disasters that happen in this country really are born out of some kind of negligence, so to speak, be it flooding, be it even the fire disasters. So we're carrying out a massive sensitization program across the country on the dangers of this negligence, on the dangers of what this could cause, losing lives and properties. So that is also in the pipeline to see that we're able to reduce the number of disasters happening across the country.
If you say substantially, most of them are based on negligence, is there any mechanism whereby you will really penalize and, if you like, punish persons found wanting to have caused or this negligence?
Honestly, we are left with no any other option than that. We have to enforce, these measures. Once one is found wanting or is found to be really guilty, we should enforce the measures that are there, so that we deter others from doing it, and we will save lives and properties in the course of doing that.
Honorable Minister of Humanitarian Affairs, Disaster Management and Social Development, Hajia Sadia Omar Farouk, thank you so much for finding time to come to our studio to discuss this very special edition that focused on the challenges your ministry is facing in distributing palliatives for COVID-19 and generally actualizing and implementing your mandate. Thank you so much.
Thank you very much, Mohammed.
Ruth Aguele, as usual, thank you so much for being there and supporting the program at the same time. In the past 50 minutes, Honorable Minister for Humanitarian Affairs, Disaster Management and Social Development, Hajia Sadia Omar Farouk, responded to questions on platform, particularly on the federal government's desire and commitment to ameliorating the plight of the less privileged, the poor and the vulnerable persons as Nigeria tackles the scourge of coronavirus. That's platform. I am Muhammad Kuda Bakar. Bye for now.